Hey guys, today I'm going to talk to you about something called corneal cross-linking. I'm Dr. Aparna Shah, board certified ophthalmologist and cornea specialist, and you have heard me talk about something called keratoconus in the past. Well, what keratoconus is a quick refresher. It is essentially a cone-shaped cornea. The cornea is the front structure of the eye. Now, when you have keratoconus, the issue is that you have something called irregular astigmatism, meaning your astigmatism is very hard to correct with glasses. It can be a little bit easier to correct with contacts, which is good, but sometimes your cornea is too cone-shaped or even unable to correct it with contacts. If you show up to your eye doctor's office and say you do have keratoconus and your vision is still fairly good, there is an option for you called corneal cross-linking. Before I talk about what corneal cross-linking is, one thing to keep in mind about keratoconus is that keratoconus is a disease that tends to worsen in your 20s and 30s. It is also worsened by things like eye rubbing, which can significantly thin and make your cornea bulge even more. So, corneal cross-linking is a procedure that we can do to potentially prevent the progression of keratoconus, which is great because if you can prevent the progression and your vision is already fairly good, you can preserve that vision right where it's at. So how do we do corneal cross-linking? The good news is that it's a relatively quick and painless procedure. It is usually done in an office setting, at least it is at my practice, but it takes about 1 hour, and it uses riboflavin, which is vitamin B2, plus UV light. And what those two do is they cause the fibers in the cornea, the collagen, to strengthen. And when they strengthen, they stiffen. And when they stiffen, it means they're less likely to bulge forward. So I tell my patients, you can take your 25-year-old cornea and you can stiffen it and freeze it in time and place. The benefits of doing this is that you can hopefully prevent keratoconus from getting worse. And if you do have good vision or good visual potential, you can maintain that without having to do something like a corneal transplant, which can be a little bit more invasive. Afterwards, you will be on a few eye drops, usually an antibiotic, a steroid, and some artificial tears. You will also go home with something called a bandage contact lens on top of your eye, because that'll help the skin layer underneath heal. After 1 week is up, your vision will start to come back to normal, and in some cases can even improve after this procedure. Typically, what we're doing is stabilizing the cornea, but in some cases, it can flatten it slightly and improve the vision. If you have any questions, drop them down